Hi, Dr. McCarthy here, and I want to welcome you to my video regarding our upcoming workshop on blood sugar and diabetes. We're going to talk a little bit briefly about some of the things that we're going to discuss in this workshop and why it's so important that if you or someone you know and love is dealing with diabetes or they've been termed pre-diabetic, that you need to get to this workshop. The stuff that we're talking about here is life-changing information. According to recent estimates, there's between 30 and 40 million Americans who are diabetic. And this is not just like some genetic disorder, you're born with it and you've got to deal with it. This is people who are making an overwhelmingly poor choice in their health and they're creating their own situation. This is something that can be changed. Insulin resistance is the situation that leads to diabetes. And if you've been to the doctor and they say, hey, you don't have any problems yet, you're pre-diabetic or you're dealing with insulin resistance, let's just keep an eye on it and you don't have to do anything. But when it gets bad enough, typically fasting blood glucose over 126, then they'll say, okay, now you have diabetes, here's some pills. That's insanity. That's like saying, well, let's just wait around until you need a brain transplant. You know, if you find a problem, you need to fix it. The issue is that traditional healthcare doesn't know how to fix blood sugar problems. All they know is how to give you pills. And the pills make your problem worse. Obesity contributes mightily to blood sugar problems. About 30% of the United States is classified as obese, and this is horrible. That leads to insulin resistance, where the insulin can't help the blood sugar to get out of the blood and into your cells. If the cells don't get glucose, they don't function properly. Especially when we're talking about neurologically, this leads to brain degeneration. Insulin resistance in your brain leads to a whole host of big problems, and this is what we deal with here in our office specifically. Cytokines, these create inflammation, like reactive oxygen species, again, inflammation. Mitochondrial damage. If you have damage to the mitochondria inside your body, you're not producing energy. Decreased synaptic functions, nerves can't talk to one another. When that happens in your brain, bad news. Disrupted blood-brain barrier, the protective covering that keeps the bad guys out from your central nervous system, that gets disrupted when you have insulin resistance. Altered NMDA receptors, so now the cells can't function properly. Leads to cell death, and then what some have termed type 3 diabetes, Alzheimer's. That's dementia that's directly related to blood sugar. You're not getting glucose into your brain cells, you're dying. So if your doctor says, well, you're pre-diabetic, this is what's going on inside your body. You can sit at home and wait until your doctor gives you some pills, or you can come to my workshop and find out how you can get your life changed. We have people who are taking insulin who come, they make their lifestyle changes, they make dietary changes, and they no longer need insulin anymore. This is not magic, folks, but you have to take responsibility. It starts with calling my office and setting up a time, reserve your seat to come to the workshop, and I hope to change your life next. Thanks.